All right. I hope. Hello.
Yeah.
I hope my lighting is. I hope my lighting is okay. No shy now.
Yes. Oh my God. I'm so sorry for the
It's my
delay.
fault, I beg.
I also apologize to everyone. No, no, it's fine. Anything could have happened on my end, on your end. And so I'm apologizing on my behalf and from Samuel's behalf. We're so sorry. We'll go ahead with this live. We'll have it and then we'll post for people to watch. You're welcome once again. Thank you
Welcome.
for agreeing to come live with me despite your busy schedule. And all right, so let's just start right away. We've wasted a lot of time already, so let's just start.
It's good to hear your voice on a closer. All right. All right. That was a lighter note. And thank you for this opportunity. Thank you very much. It's an opportunity I don't take for granted. Every time I have the opportunity to share value, to share knowledge, and to break tables, I don't take that opportunity for granted. I break tables for a living. I hope I get
Ah,
paid for breaking tables.
you're welcome.
All right, so over to you, ma. Or can I start?
Yes,
Okay.
start. I'm not here to moderate, so you have been one to break all the tables. Anything about health, let's just know
Oh,
it because I know you're a very. I'd already done an introduction in the last live that we couldn't
okay.
go live together. So I'll just do it again. So everybody, you're welcome once again. My guest today is Pharmacist Samuel Mbuk, a phenomenal pharmacist, a self-development coach. In fact, is involved in a lot of developmental work. Last I saw him, he was at the international celebration for boy child, and he also spoke. He's very passionate about impacting people, and it's one of the reasons why I invited him to come on the live with me. So everyone with Jesus joy, please welcome Prophet Samuel Book as he speaks to us on
I'm
health.
blushing. I'm blushing.
Welcome. So go ahead.
Thank,
God is yours.
thank you very much. Thank you, and thank you very much. I don't take this opportunity for granted. Thank you for bringing me in here. I'm not the best. You could have reached out to another person. I just take it as a privilege, not a right. Thank you very much. And hi, everyone. Good morning, good afternoon, and good evening, depending on when you are going to see this video. I'm going to be talking about health myths, and I will narrow it down to medicine myths or drug myths, as the case may be. We live in a very strange times and society, and we know that whatever we believe is very subjective. Like one of my mentor asked one question in one of his master classes. He asked us what is our favorite colors, and we some say blue, some say red, some say white, and all of that. And he now asked us, why do you prefer the color you think you like or you say you like? We're tongue tied. We could not say anything because we didn't have substantial reasons. We didn't have anything tangible to tell him this is why we like the color that we like. I like blue. I could not tell why I like blue. And of course, that's how meat is. You can't practically explain why you hold that thing so dear to your heart. You can't truly tell person, this is why I do what I do. This is why I believe this, that this drug, this health condition is this way. You get, so that's how meat is. Meat are, I would say that meat are destructive. They don't hold any good. The reason is a lot of people have died sincerely believing the lies. They have died sincerely believing falsehood. And this evening I'm going to be, you know, saying a lot of things that I hope I have the permission to do that. These things are not they are not they are not false. They happen real life. I've been practicing in a community pharmacy setting for the past 8 years plus, so I can tell you for free I have seen a lot. I've also interfaced with my colleagues in the hospital. I've interfaced with my colleagues in research. I do research myself, so I can tell you for free that these things are not hearsay, because there are people that are master at defending what they don't understand. You know, you can put something online and somebody comes, well, how do you know it's true? I know that it is true because I have seen it live. They tell you, where is the basis? There are a lot of things that happen on earth where research has not been carried out on it. That it has not been researched upon does not mean they don't happen. And so that's why, as you're watching this video, whenever you're going to be watching it, with an open mind, and also make your own research, and you will find out that they are true, that certainly these myths are destructive. They they can people lose their lives. And I will just start by saying that there is nothing good about believing what is not factual. There is nothing good in believing, especially when it comes to health. There is nothing good in believing what sciences have not proven that, okay, this is what causes this problem. This is what can this problem can lead to. If science says otherwise, please don't believe it. And I work every day in the pharmacy, and you find somebody that is sick coming to advise another person that is sick. You visit the pharmacy, maybe you want to get a refill for your prescription, and you find another person that is sick. You see the person start telling, use this one. But you came to the pharmacy and you are sick. You find them in the hospital too. You visit the hospital clinic. Especially, it happens, especially pregnant women. You find another pregnant woman that maybe is going through one thing or the other that took them to the hospital. And you too, there's a particular problem that took you to the hospital. You became a doctor to that person instantly in the hospital because of what? Myth. Things that you believe that were passed down from generation. So I would continue by saying that myths are unfounded facts. They are not true. They are also not truth. I don't want to go to that conversation because the difference between truth, and fact. Something may be factual, but it's not true. For example, um, some people believe that going to the hospital to give birth still is not beneficial,
Mm,
and
mm,
that one person went to the TBA, that's traditional birth attendance, and gave birth successfully, does not mean that should be used as a criteria for other women not to go to the hospital for antenatal or even postnatal or even perinatal. So you have where a lot of people, I know me, my own, I used to give birth to my children at home, really. And that myth is passed down from one generation to another. It becomes a virus and a vice that even the male gender believes it. There is a case somewhere in one hospital here where a woman lost her life because the in-laws and even the husband insisted that she has to give birth vaginally. That's what they call normal birth. And they were warned against it. The woman died. A myth. They said you have to give birth, that you can do it. Even when medical care and medical science have said, hey, this particular pregnancy, you will need to be a section, cesarean section needs to be carried out. And they insist. Well, what I tell the female gender is, before you even get pregnant, please have money. So that when you are in that position, you can make decisions by yourself.
and take a decision.
So that you don't put your life in the hands of a foolish person. Sorry, but a lot of foolish things happen. So that, in the name of trying to obey or something, you can remove your money, carry out the CS, and still go back home alive with your baby. Because a lot of women
Yeah.
have died in that myth journey of believing that they must give birth. And there's another myth. See, I'm going to be saying it randomly. I did not write a script. I'm going to be saying it randomly. Another myth, especially for the women, they believe that if you don't give birth through the vaginal route, that you are not a a real woman. You're not a normal woman. Sisi, or whoever cares to listen to this, there is no such thing like real woman or abnormal woman or unreal woman because you gave birth through CS. That does not hold. It's a lie. In fact, that lie is from the pit of hell for anyone who believes that there is hell. Whether you give birth through the vaginal route or you give birth through through a section, you are still a woman. In fact, what makes a woman is not majorly not even giving birth, because anybody can give birth. Anybody at all, provided the person is a woman. What gives you that strength of womanhood is the ability to carry that pregnancy for 9 months and birth that child. And in fact, it is destiny defining journey. You are carrying a destiny, not a child self. Just like in the Bible, where I think it's Rebecca, where God told him that you are carrying two nations. So it's a destiny defining journey. That's what makes you a woman, not because you were able to give birth through the vagina and you are not able, this one you are not able to give birth through the vagina. I'm going somewhere. You want to say something?
Yes, I wanted to cut you there because I know that you have talked about people not wanting to obey or listen to
Medical
advice
advice.
from the doctor, yes, to to go through a C-section. So what would cause a woman not to be able to give birth through the vagina? What are those
Okay,
conditions?
okay. There are a lot of conditions, complications, like in quotes, supposed complications that may happen if you try to insist on giving birth through the vagina. Some, it could be the woman has not fully dilated. I hope I'll be able to explain this in a way that the woman has not
A
fully
labor.
dilated. In a layman's way, um, the woman's cervix. I'm still going to that place. I don't want to go to those big medical grammar. Okay, the woman has not fully dilated. That means the processes that would lead to her being able to give birth naturally has not been, those conditions have not been fully met. So if those conditions have not been fully met, the medical practitioner handling that case will say, see, we are going to carry out a cesarean section. And some, it could be the process conditions were met, but in the course of trying to ensure that the woman gives birth vaginally or naturally, in quotes, something goes wrong. You now hear emergency cesarean section. So a lot of I would love to mention those conditions, but I'm not part of those people that
Okay,
likes blowing medical jargons that people don't understand. But just know
really
that you say
okay. You
that for a
define
person
what
that for a person to be able to give birth through the vagina, some conditions has to be met. Those conditions, whether they are physiologically or pathologically, physiologically the normal processes are met. Pathologically, for example, some health condition, there's popular one, placenta previa. How do I explain that in a layman's? That's why I didn't want to mention them. The weight of
you
the
don't
child
need
can
to.
be okay. The weight of the child can be so much that the woman cannot push. Sometimes the woman can herself not be healthy to even be able to push. You go see a very skinny young woman nowadays that babies are giving birth to babies. You want to go and try that skinny baby to go and push, you are going to lose her. So cesarean
Okay.
section is advised. And other um, conditions that can, some people can be they can be HIV positive, and
Okay.
what happens, exchange of blood.
Yes.
So the easiest way, just cut up and bring your baby out so that they won't be exchanged of, because that virus can be passed through during the process of delivery. So there are a lot of conditions and a lot of rules that must be adhered to before they can say, okay, don't give birth this way. please use the alternative route or route as the case may be. All right. I hope I've answered
Thank
that.
you.
I hope I've answered that question.
You have
All right.
thoroughly.
Okay.
Yes,
Okay.
you have.
So let's go back to our myth. I said something around not real woman and not real woman. Please. And it has come to a point where even the women shame the other women. Yes, they will tell you, you are not a real woman. You gave birth. That one that gave birth under the knife is a myth. You are not better than the person that gave birth through CS. You are not a superwoman because you are able to push 10 children. If they told you that, you believe another myth. If they told you that being a superwoman is your ability to push 10 children out and you believed it, you are believed another myth. Because somehow, some way, somehow, however, life will happen that maybe your child or your grandchild may need to give birth through the other means. And if you opt against medical advice, you may lose that person. All right. So there are a lot of other health myths apart from women's wahala. Let me just drop that there. General health before I now go to my core area, which is medicines. A lot of people believe that HIV is spiritually transmitted. Well, it is well.
Yes, sir.
It is well. That's not true. That's not true.
Okay.
Not true at all. You can only get HIV. In fact, one of the major routes, and one of the major routes with which one can contract HIV is through the sexual route, and then the other route of sharp instruments and all of that. The
Sharing
truth
of
is,
needle.
yes, the truth is, all these things we believe, we can't anything that you cannot explain, you should not pass it down to the next person. And I noticed that Africa runs by intuition, especially the traditional herbalists. They run by intuition. They seem to know this thing, but they can't actually tell you this is, sciences have a pattern, a process with which you can say this result can be replicated if you follow this way. This myth, you can't replicate it. You can't say this is how to do this, and that makes it very difficult to pass that knowledge to another person. That's why my grandmother did this. Used to carry this herb. Did you ask your grandmother why she gave this herb to this particular condition? Meanwhile, let me just tip this in. A lot of people still believe that the herbs, as the traditional medicine, is more potent than orthodox medicine.
Yeah.
I laugh.
Loud it.
I laugh because if we truly want to carry out research, we'll find out that more people have even died using the traditional medicine. It's just that when they die, they are attributed to witches and wizards. If we truly want to carry out autopsy in, let's say, 100 people, out of 1,000 people that die, 100 people, we can definitely trace it to people that, consistently use herbs, drink all the agbo, gbogbo rishe, all of those stuffs. If we really want to trace it, we will find out that those people not be willing to kill them. Because what you call herbs is a combination of many active ingredients. But the white man's drug, the active ingredients, we have removed one and say this is paracetamol, acetaminophen, that is responsible for making your headache go. And this is how it does it. Or even if they are not sure of how it does it, this is how it's taught to do this. But our herbs, we can't say this is how it does it. So how do we now trust the what we can't truly explain as our critical point of reference and intelligence and proof of solution? I'm speaking too much English.
Just go ahead. You
so
understand.
so that's just it. Whatever medical, in fact, even medical sciences at some point, know their limits. That's why if you work in the hospital, there are some cases where the consultants will tell you, man, we've not seen this before. They don't try to
Yeah.
overdo. They know the place of the supernatural, so they don't try to overdo. But this myth tells you, for where the discount the place of those extreme that these things can take you to. So myth is all shapes of is a no-no, because it has proven to kill more people than even the ones that you are scared of. Meanwhile, everything on this earth, like I often say that everything on this earth has a side effect. The only person that doesn't have side effect is God. Every other
Yeah.
thing has a side effect. But medical practice say if the beneficial effect outweighs the risk, then it is worth taking. The myth you are believing it, the risk is 1001%, because it's not worth it. You have not been able to weigh it in the balance. The next one, hypertension. Some people believe that malaria can give them hypertension. You find them come to the pharmacy, their BP is high. They tell you, because I have malaria. It is well.
Hmm.
You check the BP after they don't treat malaria, the BP is still high. And they still believe that,
That
don't
is
worry, the malaria. But we have treated the BP. That's the power of the mind, what you believe. And until you unlearn it, that thing will still be there. Until you unlearn it and know, this is not my. In fact, the genesis of finding a solution to a problem is identifying the core cause of that problem. If the identification of a problem is not known, the suffering will continue. And you can suffer like that for life, because you have refused to unlearn, or let me use this word, unbelief, if there is such word. You have refused to unlearn and unbelieve what you have been believing. So the dangers of believing, I'll still be referring to it, so that whenever you're watching this video, you will know that everything that you believe as myth will not do you good. In fact, it's a highway to the grave. You are the one packing your bags, heading to the grave, believing what is not true. Let me say that again. Whenever you believe what is not true, you are packing your bags, your highway to the grave. You are the one fastening or facilitating your journey to your death. Of course, people will say God forbid, but God forbid is not a strategy of survival. People have not survived because they said God forbid. All right, the next one is, so malaria is not responsible for BP. The next one is, malaria is caused by typhoid, or you hear the phrase, I have malaria typhoid. These two sicknesses are wall apart. Yes, some slight symptoms may be similar, but there are very distinct differences between
chemistry.
two of them. One is caused by a bacteria, the other one is caused by a parasite. They no be friends. But of course, our myth that we've been believing tells us that malaria is caused by typhoid. Typhoid is caused by malaria. So when you want to treat them, you treat them together. Such a myth. The same myth that have made people believe that going to the hospital is is a crime. Yes, our hospital may have their issues, but it's not an excuse to say you don't want to go to the hospital. They say half bread is better than none. I think that's an old saying. I think it has escaped my memory. It's not now not in use, but assuming it's still in use, they say half bread is better than none. It means going to the hospital is better than not going at all. So try as much as possible and unlearn those things that you learned. and get to the hospital. I've had I've had conversations with people that face to face with these things, and they will tell you, yes, so hospital have their challenges, but I'll still rather go to the hospital. And unfortunately, these myths are not believed by people we think don't go to school. In fact, I have I stand to be corrected. I found out that the people that go to school even believe these things more than the people that have not gone to school.
More than. Thank you.
And it makes me
True.
cry. And it makes me cry. Well, I am not too surprised because there's a difference between going to school and being educated. We have too much of people that only go to school, but education, zero. Because education is your ability to find out your ignorance and doing something about it. I think this is the first place I'm saying this. Your ability to find out your ignorance. It doesn't need you to go to a classroom. The ability to find out that I'm ignorant in this area and doing something about it. Not holding on to those beliefs that will kill you. Diabetes, myth, where you eat plenty sugar, you have diabetes. That is not true. If you like, pump the whole sugar. If your pancreas and insulin is working, diabetes will be far from you. You don't have diabetes because you take plenty sugar. You have diabetes because the organs that are responsible for regulating your sugar, something is wrong with them. Whether it's a type 1 or type 2 or pregnancy induced, there's another one now called gestational diabetes.
Yeah.
So either of them, in fact, there's another one called diabetes insipidus. So
Mm.
those things don't happen because you take plenty sugar. They happen because the organ, the body metabolism of sugar is altered, and so you you start presenting with the symptoms that you have. I don't want to dwell on these things so much. So when you find yourself urinating frequently, it may not necessarily be diabetes. Not all frequent urination is diabetes. Some you don't drink plenty water, or some
Mm.
it's a cold day, or some it may be UTI, or some it may be urological problem, let me like prostate enlargement or prostate cancer as the case may be. It's not all urinary issues, it's diabetes. That's another myth. Small thing, I have diabetes. The next one is ulcer. Um, I have ulcer because I've not been eating. Ah, they will just come and they have maybe upper epigastric pain. That's upper the pain in lower chest.
Yeah.
Symptoms and after investigation, you find out that they are they have ulcer. Hey, you see their reaction, which is normal. Hey, but I used to eat now. Why am I? There are some things that can cause ulcer apart from not eating. Meanwhile, not eating does not cause ulcer. It only predisposes one. It only predisposes you, so to say. It's not the is that if you have not eaten, you are going to have ulcer by fire by force. Ah, we are even the ones that pray and fast. We should cast and bind it. Does the stomach doesn't know the stomach does not know that the Nigeria the way Nigeria is. So ulcer can be caused by bacteria, can be caused by imbalance in your intestinal makeup, because in our intestine something is responsible for protecting it. There's a barrier just like our skin. When that barrier is off, of course, when you expose when you, what is protecting a thing is exposed, that thing can be under attack. Drugs, which we are going to come to that. I'm just calming down. Drugs can also be responsible for causing ulcer, especially the pain relieving drugs. Steroids, this one very very important. I wish the day the day God will give me plenty audience to talk about this one. I'm going to break table. People are not going to like me. So those steroids that they are taking, they want to fat. Steroids are major um, route with which one can have ulcer. So not necessarily because you have not eaten. All right. The next one is madness. Let me use that word, madness, insanity. A lot of people think that all the insane people they see on the street is their village people have beaten their heads. So you see mad person say, hey, oh, won't you don't do this one again? Hey, they will see another one in one of the streets. They say, hey, this one, oh, see, very fresh mad person. Hey, they don't beat in head, scatter. They are not true. After all, if you didn't know, I'll put it to you that there are people that are well dressed, but they are mad. Many people are mad. Very few walk naked. So that you see a mad person does not necessarily mean their village people is after them or has done that. Some hard drugs can cause that. Imagine somebody that have not taken Igbo, hemp, and decides to take it. The person is boom. During my during my internship program in a community pharmacy, since my calling was for community pharmacy, I had one young man that came to the pharmacy. He was brought to the pharmacy by a caregiver. The boy had gone north because he joined his friends to that time. That was a time where Novalin and codeine, in fact, drinking codeine was raining like
You know,
before it was banned. It was a norm. Ah, we have not seen anything. I think that should be around 2016, 2017, 2018, 2019. The guy went north and they brought him. I referred them to a psychiatric hospital because I noticed that this one giving something to try to reverse it, he needed a long-term management and care. So sometimes drug, sometimes emotional trauma, sometimes life can happen to anybody. So when you see that, don't allow your meat mindset make you think that the person's village people is after them. If we do that, we are going to underrate the true causes of this thing. And when the true causes of this thing are underrated, finding solutions to them and also advocating for to these things, we will not be able to achieve it. It's just like the case of rape. The reason why we have not been able to map out rape in our society, this is just by the way, is because we underrate the effect of rape on the victims. We say, after all, last dem go dey alright. Who told you that? So we in fact we see rape as just one of those normal crime. No, when you underrate the effect of a thing on people, you hinder the pathway to solving that problem. So all these myths we are mentioning, it's to open your eyes to know, so that you can start thinking outside the box. If you have a relative, a friend that is going through this stuff, tell them, I watched on YouTube in Pharm guide that this thing is not like that. Oh, let us go and try and see if we can seek proper help. Not just believing and And that brings me to the next point. Your church, I will say it, your church is not the hospital. Yes, I'm going to say it. I believe in God too. Your church is not the hospital. That myth that your papa is a doctor is a lie. Except your papa is a medical doctor. Even when he's a medical doctor,
Um,
you should be taken care of in the hospital and go there and do prayer ban. In fact, there are plenty of people in the hospital that need your prayer. So this is a major myth, especially in Africa, Nigeria, and Akwa Ibom to be precise, and across other regions. Church is not the hospital. This myth has been passed down from generation to generation. I lost my very dear friend and brother. I will not forget that guy. That guy could draw. He had cerebral malaria.
mm,
They took that guy to the church. They beat the hell out of him. He died. They tied his hands because the guy started suddenly, you know, how sometimes cerebral malaria can just confused, talking, hallucinating, and all. So they tied him, they beat him, they beat him. That's how Savior, may his soul rest in peace, lost his life because of myth, because of believing things that are not true. At least, even though you want to believe it, think outside the box. At least try first. Try. Make it be say you don't try. Don't just believe that the road to freedom is a straight way. Sometimes it's not straight though. It's not straight. It is not cast on stone. So your church is your religious center, not a health center. I'll say that again. Your church is a religious center, not a health center. So when you are sick, go to the hospital. Ask Papa to come and pray for you there. At least evangelism can be very strong because there are other people Papa can preach to or pray for. There are other people Papa can also see and pray for and lay hands. If Papa lay hands on them in the hospital and they are fine, when I don't get come people,
yeah.
go to the hospital. Your church, because this is a very stronghold that holds us like this. Say you know religion if religion fit tie your neck and you don't know that religion na tie your neck, you think it's your village people. And I notice that myth and religion they go hand in hand. They have something in common. There are some things that people in the religious cycle believe that don't exist. The way they will argue it, even yourself, you will think they're arguing between Arsenal and Man City who will carry the league. All right, so let's get to drug. Please, how long do I still have, please? Hello? Hello? Oh, network. All right. So when you put all these things together, you can go and verify them. Myth has done more harm than good. Please, how many minutes do I still have? Hello? Hello? Oh, network. 10 minutes more? Hello?
Can you hear me?
No, please, I didn't hear you.
Yes, yes, 10 minutes
Okay,
more.
all right, thank you, thank you, thank you. I like being time conscious. I don't like my host pursuing me. So I will come back to what I said at the beginning, that something can be factual but not true. It can be true but not truth. And most of the times, this myth, they may be factual, but they are not true. I think true and truth is superior to fact. And you can find out, you can see that medical sciences work with facts, and they take human the rights of human beings into serious consideration before putting out any fact. That's why health is one of the most critical part of human existence. Only diligent people go into health. Unfortunately, drugs found their way into the hands of people that are not diligent. And you find a lot of these things happening. All right. Number one myth around drug is the concept of expiration. Um, Naturally, our natural mind believes, thinks, assumes that when a drug is getting to expiration, it is no longer effective for use. Well, can be true, can be false. In fact, don't worry, just calm down. I'm going to arrive at where I'm going. In fact, there are some drugs that are even more effective when they expire than when they have not expired. I didn't say you should go and take those drugs. Hmm? Disclaimer. I'm just trying to tell you that what you used to believe, that as soon as drug expires, drug don't spoil. No doubt, it is advisable to adhere to expiration guidelines. But sometimes, in rare cases, that drug that supposedly expired may be needed to save somebody's life. And I bet you, if you were the person that needs that drug to save your life, you are going to need it regardless whether it has expired or not. So it is advisable to adhere to expiration guidelines, but don't completely believe. Hmm? It is good to adhere to expiration guidelines, but don't completely think that. Uh, in fact, some people, as soon as the drug is getting to 6 months, they don't even want to hear about it. They don't want to get it. I keep asking patients this question: assuming you are on your dying bed and you need a particular drug to save you, and they say that drug has expired maybe 1 month ago, and that's the only option you have, with all amount of sincerity, would you ask the doctors to try that drug on you? You will gladly do. In fact, with all your, you will gladly do. So what's the this thing around, it has expired, it's 1 month to expiration, I cannot take it again? No. There are some drugs that even after 2 3 months they are still effective, but because of human psychology and mind and all of that, when they have expired, they are not selling it to you again. So of course we still follow those guidelines, but there are some instances where the person might need that particular drug to save their life. They will still use it. At least they tried something to save you. Meanwhile, there are a lot of conditions that can make drug still retain their efficacy. Good storage condition, good transport system, the processes with which the drug was manufactured were properly done. the good manufacturing practice we adhere to, quality assurance we ascertained and carried out on them. Those are things that are taken into consideration when producing drugs. And those things too are going to be responsible or okay contribute to whether these drugs will retain their strong point or selling power even after expiring. I didn't say you should go and take expired drugs, so I beg. All right. Combining two drugs, especially pain relievers, because you want to get booster effect. That's another big myth. Because you want to get booster effect. You are not a doctor. You are not a pharmacist. And only you pack three drugs. The pain is very serious. This pain has to go. You pack three of them and take. The three drugs are not going to do more than one drug is going to do. If they do, if in fact even they do more than, it's just small added effects. No doubt there are some instances where more than two drugs can be given to a person, especially in pain, but those drugs cannot act the same way. The principle with which drug is combined is for synergy and complementary effect. But of course, people combine. Should I mention the names of the drug here? No. People combine more than three pain relievers because they want to get added results. Those things are myth. All right. Antibiotics. Antibiotics cannot treat flu. Antibiotics treat bacterial problems. Just like carbohydrate food provides carbohydrate. You cannot carry carbohydrate food and say it should give you protein, amino acids in your body. Okay, I should mention, okay, they combine diclofenac, they combine piroxicam, they combine ibuprofen all in one, they box it, then add small out there just because the pain is very serious and they want the pain to go very fast. It doesn't work that way. Antibiotics doesn't treat flu. Flu is viral and most flu are self-limiting. That means they can go on it on their own. Even COVID-19,
Go ahead.
even COVID-19 is self-limiting. That's why some people could recover with little or no drug. So flu are viral except there is a bacterial undertone. Then your medical practitioners can be able to decide on that. Not you going to that chemist store or drugstore to get an antibiotics in the name of uh, treating catarrh. The natural way we call it, they call it catarrh. There is flu. And antibiotics are not to be toyed with. In fact, one of the most abused type of medication on planet Earth, especially in this part of the world, are antibiotics. Antibiotics have suffered in our hands. That myth that everything you need is antibiotics is not true. It's not true. Please help our antibiotics. Help their life. our antibiotics have suffered. In fact, the next 10 to
Now,
100 years, not let me just 10 years, the next 50 to 100 years, if nothing is done very fast, we may not have antibiotics again to solve the common problems that used to help us solve because of antibiotics abuse. Give it 50 years and 100 years, maybe not in our lifetime, but give it time because of abuse of antibiotics. Somebody has malaria, please add antibiotics for me. He has typhoid, add antibiotics. If at all it was typhoid, he has even they want to manage for hypertension, add antibiotics. For wetin antibiotics do us, that myth, give me 2 capsules of ampiclox came to for wetin, for wetin. So, and the truth is, there's a lot of myths around drugs that if I want to keep saying it, we might spend the whole year. And most importantly, drug is not your enemy. Very, very important. I have to say this because we have, especially patients on chronic conditions. Chronic conditions are those conditions that require lifetime management. They will tell you,
HIV.
like HIV, hypertension, diabetes, arthritis, heart failure, the list goes on and on and on. Drugs are not your enemy. Drugs is just like food. The food you eat are still broken down and still have chemicals. The drug, the same thing. They still have carbon and hydrogen chain. So, because a lot of people have died because of refusal to take their medications in the name of the medications will destroy their kidney, their liver. You go see sha die if at all those drugs will destroy your kidney and liver. All die na die. So why not do what you ought to do at least to stay alive for the meantime? And most times these drugs don't destroy people's kidney like we say it. The effect happens over a period of time. Before that period of time, you don die go. I remember during my internship, I had um, I had a man that was around 2018 as my client. We After checking his BP, we got talking, and he was very knowledgeable about hypertension. And I asked him, sir, you seem very knowledgeable and he knows his onions and numbers. He said, I have been hypertensive for 38 years. I was, whoa, wow. He said we were two of us in their office that were diagnosed of hypertension the same time, the same year. That it is that year that he had his last child. Imagine that last child to have been 38 years. That his colleague had died long time ago because he refused to take his BP drug. This same myth of believing whether I will live with drug for the rest of my life. Yes, you will if you have to. We eat till the end of our lives. So why is drug different? I know it's difficult, but it's just our mindset. If you rearrange your mindset and unlearn those things you believe, not be we dey chop from day one till our last day, it's the same thing. Whatever you are doing to improve yourself and your life is not an expenses, it's an investment. Taking care of your health is an investment. And that brings me to the last before I go. Health, taking care of your health is an investment. Is an area of personal development. that I'm looking into entering. But well, I think capacity building is is a handful for me already. So health development is an investment, not your day-to-day buying and selling. It's not an expenses. You are adding to your life, not subtracting. Anything that adds to your life is a plus, not a minus. You shouldn't count it as part of your expenses. That's one of the reasons why you find people with chronic issues, they die before their time because they have refused to take they as soon as, in fact, most of them, as soon as you check their BP over and over and over again and you find out that this BP doesn't want to go down, it doesn't want to go down. I Are you sure we are going to live? Plenty things are still entering my head though.
We have to reschedule. We have to do a part two.
Oh, okay. So the BP refused to go down. They will say, so I will take BP for life. I'll take this BP drug for life. I tell them yes. And unfortunately, I'm very blunt. I'll tell them, see, other people may find a way to placate. Sometimes you cannot polish the truth. Sometimes you can't. The truth is just there. If you like, do storytelling around it. Last, you just have to say the truth. So that myth of believing that will I take BP drug throughout my life, or whatever drug you are taking, that it will kill you before the problem is not true. In fact, the drug is helping you. Let me say this before I go. Whatever you are doing to better your life is taking you away from calamity. See your spiritual development, your physical development, your career development, your health development, anything that you are doing that will help improve your life, sorry about that, is taking you away from calamity in one way or the other. If you like, let it be 1 minute of exercise, whatever you are doing. And then lastly, maybe can I keep this for the next episode?
You can keep it for the next episode.
All right, all right. Thank you very, very much. Then the ogata kpatakpata of them all is that your mind is a vessel of your life. Whatever enters your mind will enter your life. When you allow this myth, these beliefs to penetrate your life, you have successfully allowed what will kill you enter your life. Thank you, thank you, thank you. I hope with these few points of mine, I have not confused us. I have been able to tell us that myths are as good as HIV. In fact, see myth as a virus. It is a virus. Thank you, and God bless us.
Oh my God, it's such a blessing to have you. Thank you so much. I've also learned. I've learned so much. Thank you. God bless you real good. We'll be rescheduling another session with you. I will inform you before time
No
so
problem.
that you upload the remaining ones. Thank you for coming. Despite the challenges, we're able to still have this session. I'm grateful to God. Thank you everyone for joining. We're so sorry for all the lapses, but we hope that we've been able to, cover up with the education, like the information that has come to you. Keep coming back to listen, keep learning, relearning, unlearning, and we'll be having some Samuel book with us again. So we come your way again. It's bye from us. Thank you so much,
Thank
guys.
you, thank you, thank you very much. Please help share the link. Help share this link so that I can share. Thank you very much.
No problem, sir. I will. Okay, I've shared it with you, so I'll be ending the live now. Thank you, everyone. Bye bye.